Hello everyone. This video will give you some basic guidance on how to take care of yourself if you have heart disease or have had heart surgery. It was prepared by the Occupational Therapy, Physical Medicine, and Rehabilitation Division of Somdech Fanning Chau Sirikit Hospital. The purpose of this video is to guide you in recovering your heart health, so your heart can work safely and strongly. We also want to help you return to your daily life and work with more confidence. We truly hope this video will be helpful for patient, family members, and anyone interested in heart recovery. Daily activities: bathing and personal hygiene. When you take a bath, it's best to use a shower. Please avoid very hot water, because it makes your body work harder, which can make you tired and sweaty. You can use a long-handled sponge to wash your back. This will make bathing easier and safer without too much stretching or bending. For bathing, it's better to sit while you wash. Try not to bend forward or lean too much. When brushing your teeth or shaving, rest your elbows on the sink. This will help you save energy and keep steady. When you go to the toilet, don't push too hard. That puts pressure on your heart, almost like lifting something heavy. If you have trouble, eat more fruits and vegetables. If that doesn't work, talk to your doctor about medicine to help. For dressing, choose loose and comfortable clothes. It makes breathing and moving easier. Try to get dressed while sitting on the bed so you won't fall. Keep your clothes nearby so you don't need to walk around too much. Avoid reaching behind your back to button or zip. And don't bend down to put on socks or shoes. Sit cross-legged instead. For housework, start with the most important things first. Use simple tools or easier ways to do jobs. If something is heavy, break it into smaller steps and take breaks in between. Don't lift heavy objects, and avoid work that keeps your arms raised over your head for too long. When you walk, always wear flat or low-heeled shoes. They will help you stay safe and avoid slipping. If you need to travel long distances, like going to the mall, the airport, or even the hospital, it's better to use a wheelchair to save your energy. And remember, if you feel tired, stop and take a seat to rest before continuing. When using stairs, always hold the handrail for support. Take it slow, going one step at a time. If you start to feel tired or short of breath, stop and rest on the way. And whenever possible, have someone walk with you to make sure you're safe. 1. Most patients practice going up and down stairs while they are still in the hospital. After leaving the hospital, you will usually be able to manage about one floor, or around 10 to 15 steps. If you need to go up more than one floor, it's a good idea to stop and rest after each floor before continuing. If you're still not confident walking on flat ground, focus on practicing that first and avoid using stairs until you feel stronger. If there is an elevator or escalator available, use it instead of stairs. This will save your energy and reduce the risk of complications. Even though driving doesn't take a lot of physical effort, it can still put stress on your body and mind, which makes your heart work harder. Usually, doctors suggest waiting about 4 weeks after leaving the hospital before you start driving again. At first, just drive around your neighborhood or on quiet roads. It's a good idea to have someone with you the first few times. For people who drive professionally, like bus or truck drivers, a special check is needed before going back to work. Most of the time, it's recommended to wait at least 3 months after leaving the hospital before driving again. Sexual activity. Sexual activity makes your heart work harder. Kind of like walking up 2 flights of stairs or walking fast for about 270 meters on flat ground. If you can do that safely, then sexual activity is usually safe too. It's important to understand how to take care of yourself while being intimate. In general, it's safe to start having sex about 1 month after leaving the hospital. Choose positions that feel comfortable and relaxed, or where you can take a more passive role. Some heart patients may have problems with sexual performance. This can happen for many reasons, like stress, anxiety, or side effects from medications. If this happens, it's best to talk to your doctor. Also, do not use sublingual medications together with drugs that increase erections, because this can be dangerous. During the first 6 weeks after leaving the hospital, your activities should gradually increase, from light tasks to the normal activities you did before your heart problem. In the first week, you can do light household chores, like washing vegetables or preparing snacks. Make sure to take rest breaks in the morning and afternoon. For leisure, you can read a book or watch TV. Be careful when lifting things, carrying children or pets. You should only lift light objects, around 1.5 to 2.5 kilograms. In the second week, you can do slightly more household tasks, such as making the bed, preparing meals, sitting while ironing or dusting, and using the washing machine for laundry. Take a rest break in the afternoon. For leisure, you can do light gardening, like watering plants with a hose while sitting, or planting small potted plants. You can lift slightly heavier objects this week, but keep them under 3 to 4 kilograms. In the third week, you can go out with your family to run errands or shop for about an hour. It's best to do these activities in the morning to avoid hot weather in the afternoon. For household chores, you can sweep the floor and vacuum. For leisure, you can do light gardening, like removing weeds. You can lift slightly heavier objects this week, around 4 to 5 kilograms. By the fourth week, you can do light household tasks as usual, like mopping the floor, cleaning windows, and going shopping on your own. You can start driving short distances, whether by car or motorcycle. And sexual activity is generally safe at this stage. For gardening, you can pull weeds, dig the soil using a hoe or spade. You can also enjoy indoor sports like bowling, indoor golf, or fishing. This week, you can lift objects up to 5 kilograms. In the fifth week, you can do almost all household chores, but avoid scrubbing the bathroom and washing the car. For gardening, you can use a lawnmower for 5 to 10 minutes on flat ground. You can also enjoy indoor sports, like indoor golf or bowling. This week, you can lift objects up to 7 kilograms. In the sixth week, you can do all household chores as usual. For gardening, you can use a lawnmower, sweep leaves, and even do light woodworking or car repairs. You can also play golf on the course. You can lift objects up to 10 kilograms. If something is heavier, make sure to have someone help you. Precautions: stop any activity if you experience chest pain or tightness, shortness of breath, or difficulty breathing, dizziness or healing, faint, irregular or fast heartbeat, nausea or vomiting. If these symptoms happen, slow down your activity. If it doesn't get better, stop immediately. After resting, if it's still not improving within 5 minutes, take a sublingual medication. You can repeat 1 tablet every 5 minutes if needed. If after taking 3 tablets you still have chest pain, go to the hospital immediately or call emergency services at 1669. Follow the instructions in this guide carefully for all 6 weeks. This will help your heart recover fully, allowing you to return to work and daily activities safely and effectively, without complications, and improve your quality of life for yourself and your loved one. We would like to thank everyone for watching and listening. Thank you.